Hi, my name is Dana Shulo, and I am the Manager of Health Programs at the National Down Syndrome Society. Thank you so much for watching this short video resource on practicing inclusive mental health care. I'm honored to introduce Dr. Ruth Brown, who is a licensed clinical psychologist and the director of the HOPE Lab at the Virginia Institute for Psychiatric and Behavioral Genetics at Virginia Commonwealth University. Her research and clinical work are dedicated to improving the mental health care of people with Down syndrome and other intellectual and developmental disabilities through improved detection, prevention, and treatment of stress, anxiety, and depression. Ruth came to NDSS with the idea to create the tool we are using today. So how did you come up with this initial idea, Dr. Brown?
Well, it really came from talking with families and self-advocates about their difficulties accessing mental health care. And so I wanted to give something that could kind of aid caregivers and self-advocates in being able to meet that need, but also wanted to speak directly to mental health professionals and encourage them to step up to the plate and to help them understand that they can meet the needs of people with Down syndrome. And maybe the kind of long story, or longer version of this story, is that I was originally trained, like most mental health professionals, to treat typically developing youth. Within most psychology programs, like that's the primary focus. I was trained to diagnose intellectual disabilities, by doing IQ testing, but not how to provide mental health treatments for somebody with an intellectual or developmental disability. And so I think I assumed, through the course of my training that I think like many others do, that there were other people who specialized in that population. And so it wasn't until I was completing my final clinical internship year that I realized those services basically don't exist. I was working in a residential facility for people with intellectual disabilities, and I realized just how neglected mental health was. There were psychologists who were there, that focused and were trained specifically for intellectual disabilities and developmental disabilities, but their primary focus was on kind of skills training or behavior management, but not recognizing and treating the underlying depression or anxiety or trauma that might be underlying those, kind of challenging behaviors. And so that was what caused me to shift my career and really focus on this population. I really fell in love with doing that work and felt that kind of need for advocacy. So that was kind of where it started. But then like over the years, as I started doing more research on mental health and people with Down syndrome, was kind of going around collecting data, talking with families, meeting with self-advocates, and giving talks on mental health to parent and advocacy organizations around the country, and just heard again and again from parents how difficult it was to find mental health providers, that they would be like kind of turned down as patients and be told, sorry, I don't specialize in Down syndrome, or I don't really know how to help your loved one. I don't really know what I'm doing, and that I think a lot of mental health providers experiencing a lot of discomfort because it was kind of outside of their experience. And I think they were nervous about practicing outside the scope of their competence, or they had assumptions like that people with Down syndrome were going to require specialized services that they themselves don't have, or the belief that surely someone else in their community has that specialization. But unfortunately, they don't, because I would hear from families that lived in like really high resourced areas and still had difficulty finding those services. And so what I hope that this resource can raise awareness among mental health professionals that people with Down syndrome need mental health services, that there's a shortage of providers who are kind of willing and able to provide those services, and that in most cases, providers have already the skills that they need. They just need to make some like little tweaks to their practice in order to be more accommodating and inclusive. And so that was where the idea. And so I was so excited to be able to work with you and National Down Syndrome Society to be able to put this guide together. So in thinking about then how I'm kind of hoping that this might be used. I mean, I think having it as a resource online, I'm hoping mental health professionals will happen upon it. But I think also, what I had in mind is that a family could kind of print this off and bring it with them, to an intake appointment for a provider who has limited experience with Down syndrome, so that they can kind of help maybe alleviate some of the concerns that the therapist might have, by being able to bring this to them and saying like, here are some tips and recommendations for you. And I know parents of people with Down syndrome have had to advocate for their children and educate their healthcare providers often, because it isn't, extremely common. And so I wanted to give a resource. So that's kind of one thought, is that they could kind of go into a therapist, and for a therapist who's like, well, I would love to help, but I don't really know how, or don't have experience with this, that the parent could say like, oh, I brought this resource, from the National Down Syndrome Society that may be able to help you, kind of give you some of those resources or point you in the direction of where you can go for more information and education. So that was one strategy. And then some other ideas too, of helping to kind of reach out to mental health professionals and kind of build bridges was another option that I was thinking of. So maybe outreach to professional organizations. So Down syndrome organizations, in their local area can reach out to their state professional organizations. So, for example, within psychology, there are state psychological associations, and similar ones for kind of social work or whatever, where, they can reach out and say like, here, we've got this resource, can you share it with your providers? Or to reach out to educational institutions. So colleges and universities that have programs that train psychologists and psychiatrists and social workers, to offer to come and give a talk to their programs, to the students who are then going to be the next generation of providers, and let them know the need in the community. Because again, I think a lot of mental health providers, and including, the people who are training mental health providers, don't realize how big that need is. And so I think building that bridge, connecting with them and saying, hey, this is a need in our area. We have families. I think that personal voice of, advocacy organizations saying, we need mental health providers and there's nobody that's willing to see our kids, I think can really help build those bridges too. So offering to give a talk, a seminar, and kind of presenting some of this information, sharing these resources, will hopefully help as well.
As part of this resource, we also created a 1-hour webinar to do a deep dive into the content of the resource and how families and individuals and mental health professionals can use it to advocate and to educate for better mental health care for individuals with Down syndrome. And that can be watched for free on the NDSS YouTube channel at the link provided. If you'd like to download the Practicing Inclusive Mental Health Care resource, it can be downloaded at the link included in this post. Once you've looked at that, don't forget to check out the rest of the resources that NDSS has to offer on our website at ndss.org. Thank you so much, Dr. Brown.
Thank you, Dana.